Okay, and let me share. Okay, with my PowerPoint. Okay. All right. Can you see?
Yes.
Yes.
Okay, cool. Okay, so I'm going to review the pharmacology the 20 question study guide for the Tuesday. Okay, and after that, so I will let you guys go. So that's why you can just take a break. Okay, so I know you have a clinical rotation today, and probably you're gonna retire already. All right, and after that, so the video I will be upload to the YouTube. So if you want to review again or you miss the meeting today again, so go back to the YouTube. Okay, I will upload it later. Okay, so the first question, there's a diffuse count. Okay, so we use this medication to treat the fungal infection, right? But I just talk about it very simple. So that's why this is some kind of extra knowledge and you need to know. Okay. Diffuse count this medication, we need to check what kind of lab. We need to check the liver function. Because this medication will have some kind of liver damage. So that's why diffuse count, we need to check the liver function. So please write this one down. So this is kind of like extra knowledge. And we didn't talk about it in the PowerPoint. We good? Diffuse count. Okay, the
Yes.
liver function checks check okay. All right, and also need to remember, okay, this is treating for the fungal infection, like I now stand. So especially a patient have like an oral fungal infection, can die. I always don't know how to pronounce that word. Is a yeast infection, so you know it. Okay, so the second one, the cold sore and also a cyclovir. Okay, the cold sore and cyclovir. So the patient have like a cold sore and they're taking the acyclovir, this medication, this kind of like virus medication. Let's talk about the cold sore. Is it contagious?
Yes.
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 This is contagious. Okay. So that's why I say no kissing. Okay. So this is a contagious disease. That's why some you need to put on a mask for sure. This is kind of like a droplet contagion. Okay. It's from the HPV virus. All right. So that's why we're taking the antivirus medication. So acyclovir, either way is kind of IV or either way is a pure medication. But when we're taking this acyclovir, actually, what is the action for the cold sore? So it will helping helping the cold sore, the blister kind of become like a crass. It's no longer kind of blister anymore. It become like a crass. That's why it's kind of like a healing faster. We're helping the virus decreasing and we're healing faster. So this is their action, the acyclovir, the action. So that's why. So when you see, so the acyclovir is kind of crass, the cold sore, that means it's healing. So acyclovir is not the one to prevent the cold sore or manage the stress. No, it's not. Okay, and acyclovir is not antibiotic. Okay, that's why we don't need to take it like in a whole course. As long as it's being controlled and we take a couple more days, that's okay. But again, we don't stop this medication by yourself. Okay, we need a provider's information and provider education. Don't stop it by yourself. Okay, this is a cyclovir. All right, and a cyclovir also have a cream, so that's why you can put on your cold sore. It's becoming like a topical agent if it's necessary. Okay. All right. Number three, H. pylori. Okay, this is a bacteria living in your stomach. Okay, in your stomach area. So with the antibiotic treatment. So remember I told you H. pylori. So we get a treatment is very special. So how many antibiotics at this?
3.
Two antibiotics and one antacid.
Yes. I need at least two antibiotic, and also one antacid medication. So that means I need to see at least three medication with this treatment. Okay, so that's why the patient is asking you, why I'm taking so many medication? Because this H. pylori, this is a very naked disease. Okay, it's naked. So that means this bacteria will create the antibiotic resistant very easy. They are not afraid about the acid, the stomach acid. That's why they are not afraid about the normal antibiotic. So that's why this antibiotic treatment needs to take a little bit more longer time, like 2 weeks and maybe like two months or 3 months. All right, so that's why they are created antibiotic resistant very easy. That's why we need to use at least 2 antibiotics. That's why they don't can become stronger bacteria. This is the reason. All right, and number 4, carbonate and also levothyroxine. This is kind of antacid medication with the levothyroxine medication. Calcium carbonate. So I forgot to put a calcium. Number 4 actually is calcium carbonate. Calcium carbonate and levothyroxine. So calcium carbonate is what kind of medication? Tons. It's tons. Okay, it's very easy medication. We can get it from the pharmacy and the supermarket, right? Tons. It's colorful. So the calcium carbonate. So how we just taking with levothyroxine together?
You don't, or at least 4 hours apart?
Yes. So that means what? We don't take these two medications together because the levothyroxine will be like a stop absorption from your GI system. And this is kind of hormone medication. We want 100% absorption because you need a hormone for sure, right? For the whole day long. So this is the reason that's why usually we take the levothyroxine medication first and a couple hours apart. Okay, so that's why we are taking antacid medication. If it is kind of urgent, at least 1 hour. If it is not urgent, the patient can wait. So that's why we take like maybe 4 hours apart. Got it?
Yes.
Okay.
Yes.
Then number 5, sodium bicarbonate. This is alkyl sulfur, sulfur. Yes. So what is this medication? This medication is foaming tablet, right? We put it in the water, it will bubbling, and then we drink it. So we use this medication. This is an alkaline medication. That's why it's say alka, A-L-K-A. It's alkaline. Okay, S-E-L-T, seltzer. This kind of salt. It's like a salt. So it's a sodium. That's why it's just like a salt. We use this to balance the pH level because stomach acidic. This is acidic, and the alkaline is alkaline. That's why we're making the pH level a little bit more balanced. So that's why we can decrease the stomach acid. Okay, so the education. What happened to when we're taking this medication? The education.
Increased blood pressure.
Could be, yeah, because it's a sodium, right? It could be also have some kind of like a sodium, like a water overload. All right. It could be, yes. And what else? What's the side effect?
Fluid retention.
Fluid retention. And remember, also have some other side effect. Let me see if I can find out.
Is it like something to do with ABG? Like
No, not ABG.
alkalosis? No?
No, it's not ABG. No, because it just only happened to the stomach. It's not happening to the lung.
Oh.
Yeah, for the lung, yes, ABG. Yes. So let me see where's the medication. Zentac. B12. Okay, salsa. Yeah, here. Okay. Oh yeah, sodium bicarbonate. Okay. So how we take it is that we take it like 30 to 60 minutes before we eating and drinking. Okay, and also this medication. I didn't see the side effect here. I didn't put it. Yeah. So indication with a high blood pressure with a heart disease. So that means what? If a patient have like a heart failure, so that means this medication maybe is not good enough because it will retain lots of water in your body because it's a salt. Okay? All right.
Okay.
Number 6, famotidine. This is a tidine medication. So it's H2 blocker, right? H2 blocker. The severe side effect, the monitor. What happened to this patient's severe side effect? What kind of severe side effect will happen?
Confusion.
CNS change.
Anemia.
Yes. Yeah. Severe side effect, confusion, disorientation, hallucination. Remember the PowerPoint, I say that, right? So, because this medication will affect to your brain. All right. So that's why I say if we taking this medication long term, and a patient will cause the dementia.
Dementia.
Yeah. Remember I told you that's why the neuro doctor doesn't like this medication, and also long-term use it also causes some kind of like a kidney failure. So that's why the neuro and also nephrology doctor, they both don't like this medication. So this is the reason this antacid we just use it for the short term, like 2 weeks or 3 weeks, 4 weeks only. We don't use it for months. So that's why this is kind of like a severe side effect. Remember the neuro, okay, the CNS problem. So if a patient has some kind of confusing or disorientation, hallucination, something, this is their severe side effect already. So that's why please file a report to the doctor or your RN, okay? This is not something usual. All right. So the number 7, the same. Famotidine. So the hospital use the reason. In the hospital, we use this medication a lot. Usually it's IV. Why? We use Pepsi a lot. PEPCID, Pepsi. The IV form. Let me see if I put up in your. Yes, okay. So we treat a GERD and a duodenal ulcer. Another one is a stress ulcer. Stress ulcer. Remember this? So remember I tell you antacid we can use it for some kind of burn patient, right? It's a stress. There also physical stress, maybe like a surgery, and also. Are you sleeping, Miss Rabbit? You close your eyes, okay? All right. So that's why we're using the medication to treat the stress. Okay, the stress. So when in the hospital after the surgery or in the hospital, that's why patient is being sick. So that's why they have lots of physical stress. So that's why we use this medication to prevent have a stress ulcer. Okay, this is the reason. All right. So number 8, cytotec is used to treat for what? This antacid medication is very
Ulcers.
ulcer, yes, but treat what kind of ulcer? Very special.
NSAID induced ulcers.
Yes. That's why I want to hear. Okay.
Gastric ulcer.
No, NSAID, NSAID, like the patient that using a long-term aspirin, like a naproxen, like ibuprofen. This NSAID medication that cause the ulcer. So that's why cytotec can treat for this NSAID ulcer very well. Very well. Okay, so this is their very special treatment. Okay, number 9 again, the cytotec with the pregnancy risk. Okay, let me see the PowerPoint. I think I mentioned about it.
It's miscarriage.
Yes, very good. So the cytotec they will cause like abdominal cramping, with also including your uterus cramping. Okay, so the reason they become like all this cramping and then not good for the pregnancy woman is that when you cramping with your uterus, it's kind of like a contraction, right? It will cause a miscarriage. You're gonna lose the baby. So this is the reason. That's why pregnancy woman we do not give in the cytotec. We give other antacid medication, not the cytotec. Okay. All right. So remember, okay, it's not safe for the pregnancy woman. Cytotec. Number 10. How and when we use the antacid?
1 hour before
Yes,
you
30
eat.
to 6 minutes before the meal. Before the meal, okay? So when we want to eat something, before we take an antacid. Yeah, this is the timing, the good timing we're taking the antacid, okay? All right. Number 11, proton pump inhibitor and with the calcium and magnesium, the relationship. When we use a proton pump inhibitor, what will happen? Proton pump.
Decreases absorption of calcium and magnesium.
Yes, correct. Very correct. So this medication, well, most of the antacid will cause some kind of like a malnutrition, right? We don't absorb the nutrition very well. But proton pump inhibitor is also very special for the calcium and magnesium, especially calcium. So they will stop the absorption for the calcium. This is the reason that's why patient will get fracture very easy. Okay, that's why proton pump inhibitor, they have a fracture precaution because your calcium and magnesium cannot absorb very well. So that's why just monitor the lab, okay? So when we're taking the proton pump inhibitor with the calcium and magnesium, just see the lab is a normal. You still remember the calcium and magnesium normal lab value? You forgot.
No, 135 to 145?
No, that's that's a sodium. Okay, the calcium,
yeah.
yeah,
Bye.
that's a sodium. The calcium is 8.5. The normal range is 8.5. So below 8.5 is not enough. Okay, and the magnesium is 2.2. So below 2.2, magnesium is too low. Okay, you write down. Just remember,
Yes.
yeah,
Yes.
remember this
Yes.
the normal lab value, okay? Because NCLEX they won't give it to you. That's why you need to remember it, okay? All right, proton pump inhibitor with the infection. This relationship. What's wrong with the infection?
Increases the risk for C. diff.
Yes. Why?
Um,
It's lower acidic defenses,
the
right?
stomach acid. Yeah.
Yeah, because we don't have another stomach acid, right? So this is the reason. That's why it's a decrease. The stomach acid will destroy the bacteria, and this bacteria go into the colon and become like a C. diff, uncontrollable C. diff. Yeah, so this is the reason. That's why when we use a proton pump inhibitor, and then we need to be careful, okay, to check a patient if a patient have some kind of smell stool and the patient have like an uncontrollable diarrhea for a couple of days. So maybe you need a suspicion, okay, maybe this is kind of C. diff. C. diff, okay? All right, and then the care effect, the action. What's the mechanism we use the care effect?
It coats the ulcers.
Yes, correct. We coat the ulcer. Okay, it's a coating agent. So that's why we coat the ulcer. That's why we can just let the ulcer, they can just have a time, can heal, not directly get touched by the stomach acid, and also with the alkaline pancreas enzyme. All right, so that's why they can coat it can, at the heat. This kind of like medication with the heat was sticking on the ulcer. All right, so the care effect, the common side effect.
Constipation.
Antacid usually the side effect is a constipation and also diarrhea. Okay, either way, one of it. So either way diarrhea or either way constipation. So care effect is a constipation or diarrhea.
Constipation.
Yes, correct. Constipation. Okay, remember this. Okay, care effect is constipation. All right. Okay, number 15. So Regalan. So Regalan is using for what condition? The action. Empty
As
stomach,
GERD
right?
and then
Yeah, we can
GERD
empty
and
the
then gastro process.
Yes, yes. We can empty the GI system faster, right? So this is the reason. So this is the reason. That's why sometimes, if a patient have like a nausea, vomiting after the surgery or like a chemotherapy or radiation, so if they eat something, and the food is in the stomach area or in the GI system, they feel nauseous right away. Okay, but they still need to eat. So what should we do? Yes, we can give some Regan, okay? And the patient still can eat, but we just empty it a little bit faster. That's why they don't feel nauseous all the time. We can control to your the brain system. Do not sending lot of signal to your stomach area. Okay? All right. So prokinase agent, how's the relationship with the Parkinson's disease? Prokinase agent is what kind of medication?
Isn't it the involuntary movement?
Yeah.
Yes, that's true. Yes.
Right.
Yeah, even how well actually, prokinase agent is a Reglan, right? It's a number 15 medication, Reglan. Okay, so that's why I tell you. Okay, when you see this medication, just directly linked to the Parkinson's disease. So this medication will making the Parkinson's medication not working at all. They cancel each other. Either way, the Parkinson's medication is not working, or either way, Reglan, this nausea medication is not working. They cancel each other. So that's why this is the reason we do not use this medication for the patient they are taking the Parkinson's disease, the Parkinson's medication. Okay, we don't do that. So this is their relationship. Okay, the Zofran, the action number 17. The same, the Zofran.
Blocks. Yeah.
Yes, go ahead. Go ahead.
Does it block serotonin?
Yes, it's a serotonin agonist agent, right? Very good. So that also working to your brain. Okay, working to your brain. So that's making your brain and just not having lots of serotonin. That's why you don't feel nauseous all the time. Okay, so it's a CNS effect. So this is the reason. That's why when we're taking the Zofran, sometimes the side effect will have some kind of nausea, dizziness, and some kind of like a CNS problem, like a central nervous system problem. Okay, patient will feel sleepy, a little bit drowsy, like this. All right. So number 18. So Zofran with serotonin syndrome. Okay. So the Zofran, what will happen with the serotonin syndrome? If a patient taking some kind of medication, what medication?
SSRI,
Yes.
SNRIs.
Yeah, SSRI and SNRI. Okay, so be careful when you see the depression medications taking the SSRI or SNRI. But when they feel nauseous, try not to give it a Zofran because it is a serotonin antagonist. So that means what? Patient maybe will be very easy to trigger the serotonin syndrome. So when they taking like a SSRI, is already very easy to trigger the serotonin syndrome already. But now you give the Zofran, even easy to trigger the serotonin syndrome. Okay, so the serotonin syndrome usually also have like a G high, like a hyper temperature, like a fever. Okay, and also high blood pressure. Okay, and tachycardia, high heart rate. Is that sounds like very familiar? This is G high. Where we also learn this G high?
Cushing's.
Hypertensive and hyper temperature, fever, and also heart rate high. This three high. In what kind of disease we learn in the 10-2?
Was that
Cushing?
thyroid storm?
Yes, thyroid storm. Thyroid storm. Yes. So be careful. Serotonin syndrome and the thyroid storm is kind of like a little bit the same. Okay, they all three high. But serotonin is a little bit more complicated. Not just only these three high, they have something more. The patient have like a severe fatigue and then sweat a lot. Okay? All right? Number 19, nausea vomiting, the strong GI the calming agent. Okay, I'm talking about the calming agent is calming for your muscle. If a severe nausea, vomiting, and then there's no other medication can help, so what should we do? We can use another medication, strongly, very strong, to calm the patient. When I say calm, no, not Protanus. When we say calming the
Benzo?
patient, Yes, benzo. Yes, benzo.
Lorazepam? Yeah.
Yeah, benzodiazepine, right? Benzo. We use benzo, like Ativan and also Valium. Okay, so when the patient have a severe nausea, vomiting, and all the muscle, the GI muscle is involuntary movement, just keep vomiting, and keep diarrhea like this non-stop, and patient is very, very miserable. So what can we do? We have to calm the patient the whole body, not just only calm the GI. Calm the patient whole body, make the patient rest. Okay, that's why they can heal. That's why they can get some energy back. So that's why we have to use a benzodiazepine. Okay, but also be careful over sedation problem. Okay. All right. The next one, the final question. Ginger use the priority with other medication. We also can use a ginger. So that's why lots of people have like a nausea, vomiting. They would like to take in some ginger tea or like a ginger root, or make some ginger in their food. Okay. But when we take in the ginger, what should we know?
Don't use with anticoagulants.
Yes, like what?
Warfarin, aspirin.
Yes,
Aspirin.
true. Like a heparin, like a warfarin, like a aspirin, right? Always medication. Okay, so that's why when they taking taking the ginger and for this 4G medication, remember just tell the patient, did you just consult with the doctor and what kind of medication and the coagulant you are taking right now? Okay, because this is gonna cause a bleeding episode. Very easy. All right. So, okay, let me check attendance and let me get a pen. Where is the pen? Oh my God. There's no pen in your office. There's no pen in your office. Give me a second. Oh. Okay. Let me stop sharing first. Okay, let me call the attendance. Okay, I have a Sue here and
Yes.
Oscar and Yuri Rosaris. And this is Susie, okay,
Yes.
and Bryce.
Yes.
And here is Yuan Yuan.
Yes.
Okay. And let me see the next one. Melina, okay. And Aurora.
Yes.
And Juliana, okay.
Yes.
All right. And then let me see. For Rizzo? Okay.
Yes.
And this is Alice. Okay. And Rosie and Sylvia.
Yeah, same here.
Okay. Lorena.
Yes.
Okay. And
Yes.
this is Maggie. And April. And this is Ray. Okay. Vanessa.
Yes.
Hi. And let me see. Yana. Okay.
Here.
All right. And also, by the way, I have your pharmacology grade report already. Okay, so we can sign on Tuesday. So you'll be complete with all your term 2 all the grade report. Okay. All right. And any question?
Okay, where is No.
No. Okay. Just let me know anytime. Okay.
Okay.
Thank you.
Thank
You're
you. Good
welcome.
night.
Okay.
Thank you.
Have
Good
a
night.
great rest.
Thank
Okay.
you.
You have a good night.
You too. Bye.
Thank you.
So see you on
Bye
Tuesday. Have a good
bye.
night.
Bye. So.